For the fourth muscle for the rotator cuff, we're going to talk about the subscapularis. So we do know it's an internal rotator, and there's two other internal rotators we want to pay attention to, and that's the pec and the lat. To review the origination point for the subscapularis, we know it's on the subscapular fossa of the scapula, and it comes around to the lesser tubercle of the humerus. Now, arm out to the side for me for a sec. We know that lesser tubercle is way up in our armpit, and we wouldn't recommend that you go palpate into that area. There's a lot of neurovascular structures that we want to be aware of, but for an easy muscle test in this position here, what we'll do is bring her into slight internal rotation, and then I'm just going to support her elbow, and I'm going to try and pull her wrist out towards me, and that activates, yes, subscapularis mainly, but again, you're going to get a bit of pec and lat involvement with that. To isolate this muscle even better, what we'll do is bring her arm behind her back, and we'll flip her around in a sec to show a posterior view, but this is what it's going to look like from the front. Of course, if there's shoulder pathology or problems in doing this, this may be a difficult position for the patient to get into, but it's statistically a really good way to isolate the subscapularis muscle specifically. And then what we'll do here is it's called a lift-off test, where they just lift only their hand and wrist off the small of their back without doing too much extension of the humerus. If the humerus is extending backwards too much, we know the lat has come into play too much, and we're not being as specific as we want to be. So for the posterior view, let's have the patient swing around. When we have the patient in the lift-off position, I just want to review the palpation once more. So support hand on shoulder, her hands on the small of her back there, just nice and relaxed, and then what I'll do is just slide my fingers right in, and then I'll get her to lift off, and you can see how it just pushes my fingers, and I feel the contraction on my fingertips each time she does the lift-off test. So we're getting good strength from that muscle. Keep in mind we have to push through the trapezius, the rhomboids, as well as serratus anterior a little bit, and then the deepest one I hook into and feel contract is that subscapularis. Go ahead, lift off one more time. Good. And if we're going to palpate and approach this muscle from the other side, or the lateral part of the scapula, we're going to find that lateral border, and then I got to get the lats out of the way and come right in to it there. And then push your hand on your stomach for a second, do a little contraction for me. Good. So again, you can just have them place their hand on their stomach, push into their stomach, and that's again going to do internal rotation, and I can feel that muscle contracting each time. Again, there's going to be a bit of lat, but I'm very deep with this palpation, so I'm right up against the scapula.